Welcome to the respiratory system. The body cells need a continuous supply of oxygen to sustain life. Working with the circulatory system, the respiratory system supplies oxygen from the air we breathe to the body cells. It also transports carbon dioxide, which is a waste product of the body cells, to the lungs, and carbon dioxide is removed from the body in the air we exhale. So we inhale oxygen. It's important to remember when we inhale, we're only inhaling about 21% oxygen. And then when we exhale, we're exhaling carbon dioxide, which is our waste, as well as exhaling about 17% oxygen. Those figures are important to remember. The respiratory system is divided into the upper and lower airways. The upper airway is made of the structures outside of the chest cavity, such as the nose, the pharynx, which is the throat. Well, not quite the throat. It's kind of the the back part of your throat before you get to your trachea, which is your windpipe. And then it also consists of the larynx, which is your voice box. The lower airway consists of parts found almost entirely within the chest cavity, such as the lungs and the trachea. Air enters the body through the nose or the mouth. The nostrils are also called the external nares. The nostrils open into the nasal cavity. Air is warmed, moistened, and filtered as it moves over the damp, sticky lining mucous membrane of the nose. The nasal septum, which is that partition in your nose that separates the two cavities, divides the nasal cavity into a right and left portion. The floor of the nasal cavity is bony and is called the hard palate. The soft palate is fleshy and extends behind the hard palate. It marks the boundary between the nasopharynx and the rest of the pharynx. 4 nasal sinuses, which are spaces or cavities inside of the cranial bone, it's inside of the skull itself, drain into the nose. Sinuses produce mucus and trap bacteria. They can also become infected when bacteria becomes entrapped in the sinus tissue. Air then travels down the throat, through the larynx, and into the trachea. The pharynx is a muscular tube. It's about 5 inches long. It's used by both the respiratory and the digestive systems, and it's used as a passageway of food, liquids, and air. The pharynx is made up of 3 parts. The nasopharynx, which is located directly behind the nasal cavity and serves as a passageway for air only. Have you ever, accidentally laughed so hard you got milk or water or soda out your nose? It burns. It's meant for air only. Then we have our oropharynx. The oropharynx is the middle part of the throat. It opens into the mouth and serves as a passageway for both food and air. It is separated from the nasopharynx by the soft palate. And the uvula is the small piece of tissue that looks like a mini punching bag that's just hanging down in the back of your throat. The laryngopharynx is the lowermost part of the throat, and it surrounds the openings of the esophagus and larynx. It opens in the front into the larynx and in the back into the esophagus. It serves as a passageway for both food and air. The larynx connects the pharynx with the trachea. It functions in voice production. The length and tension of the vocal cords determines the voice pitch. The larynx provides a passageway for air to enter and exit the lungs, and is made up of the 9 cartilages connected to each other by muscles and ligaments. You cannot swallow and breathe at the same time because the epiglottis, which is a flap of cartilage, kind of looks like a leaf, covers the trachea when you are entering or when you're eating and drinking, so that food and liquids do not enter the lungs. At least that's the goal. The trachea is located in the front of the neck and is kept permanently open by C-shaped cartilages. The esophagus, which is part of the digestive system, is a muscular tube located behind the trachea. It's actually kind of connected to the trachea with cartilage, and it serves as a passageway for food. The open part of each C-shaped cartilage faces the esophagus. This allows the esophagus to expand slightly into the trachea during swallowing. The trachea continues into the chest, where it branches into the large airway tubes called the right and left mainstem bronchi. Each bronchus is joined to a lung, so one tube leads to the right and the other leads to the left. The bronchi are covered with mucus, which traps dirt and germs into the air and into the lungs. Small hair-like structures called cilia work like brooms to remove debris caught in the mucus. If you ever get a really deep cough that just something inside of you just made you cough, what happened is some form of debris got caught in your cilia. The mainstem bronchi branch into smaller and smaller tubes called bronchioles, and at the end of the bronchioles are tiny little sacs that look like little groups of grapes, and these tiny sacs are called alveoli. The bronchial tree consists of passageways that connect the trachea and the alveoli, and the wall of an alveolar consists of a single layer of cells. A thin film of surfactant coats each alveoli and prevents the alveoli from collapsing. Lungs are spongy, air-filled organs bound from above by the clavicles and from below by the diaphragm. The lungs bring into contact with blood so that oxygen and carbon dioxide can be exchanged in the alveoli. The apex of the lungs is the uppermost portion of the lungs. It reaches above the first rib, and the base of the lung is the lowermost portion of the lungs, and it is resting on the diaphragm. The mediastinum is part of the space in the middle of the chest between the lungs. The mediastinum extends from the sternum to the spine, and it contains all the organs of the thorax, the heart, major blood vessels, esophagus, trachea, and nerves, and it contains everything but the lungs. The lungs are divided into lobes. The right lobe has 3 lobes. It is shorter than the left lung because the diaphragm is higher on the right to make room for the liver that lies, right underneath it. The left lung has 2 lobes because 2/3 of the heart lies on the left of lies to the left of midline. The left lung contains a notch to make room for the heart. The lungs float within separate pleural cavities. They're separated from the chest wall by space containing pleural fluid. The pleura are the serous, oily, double-walled membranes that enclose each lung. The parietal pleura is the outer linings and lines the wall of the chest cavity. The rib cage, the diaphragm, and the mediastinum. The visceral pleura is the interlayers of and covers the surface of the lungs. The pleural space is space between the visceral and parietal pleura, filled with the small amount of oily fluid. Pleural fluid allows the lungs to glide easily against each other and as the lungs fill and empty during breathing. Certain illnesses or injuries can cause air, blood, or both to fill the pleural space. This can cause a collapse of the lung on the affected side. Breathing, also called pulmonary ventilation, is the mechanical process of moving air into and out of the lungs. This is extremely important to know. Breathing is the mechanical process of moving air into and out of the lung. That is a ventilation. Inspiration is the process of breathing in and moving air into the lungs, and expiration is the process of breathing out and moving air out of the lungs. But the mechanical process itself is known as ventilation. Respiration is the actual exchange of gases between the living organisms and its environment. And that's the difference. You need to be able to differentiate respiration from ventilation. Ventilation is the mechanical process of getting air in and out, and respiration is the gas exchange. A single respiration consists of one inspiration and one expiration. Normal respiratory rates depend on age. Tidal volume is the amount of air moved into and or out of the lungs during a normal breath. You can indirectly assess tidal volume by watching the chest rise and fall. The tidal volume of a healthy adult at rest is about 500 milliliters. Of the 500 milliliters, only about 350 milliliters reach the alveoli for gas exchange with the red blood cells. About 150 milliliters remains in the anatomical dead space, which is the volume of air contained in the trachea and main stem bronchi where gas exchange does not take place. The minute volume is the amount of air moved in and out of the lungs in 1 minute. This can be determined by multiplying the tidal volume by the respiratory rate. An inadequate tidal volume or respiratory rate can result in inadequate ventilation. So when you're sitting there and you're trying to figure out somebody's minute volume, if they're breathing too fast or they're breathing too slow, their minute volume will be off. If their chest does not look like it's rising appropriately, then their minute volume will be off.